Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese. Glad to have you here. And hey, in case you need a reminder, it is Valentine's Day, so spread the love and joy today. If you're watching the show, be sure to hit that like and subscribe button. And today we've got a great show for you. Let me just bring up my notes here so I can see what I'm talking about. It's my distinct honor to introduce Christy Krieg, President of the Certification Board for Urologic Nurses and Associates, the only national certification body established to certify urologic nurses and associated allied healthcare professionals in urologic nursing practice. Christy is a highly respected leader in urologic nursing, a board-certified family nurse practitioner, and a certified urologic nurse practitioner. As a fellow of the Society of Urologic Nurses and Associates, she has demonstrated sustained excellence, leadership, and commitment to advancing our specialty under her leadership. CBUNA continues to uphold the highest standards of certification, ensuring that urologic nurses and allied professionals meet rigorous national benchmarks for knowledge, skill, and professional practice. Her dedication to certification excellence strengthens patients' care, professional credibility, and the future of urologic nursing. So with that, let me have everybody join me in welcoming Christy Krieg to the screen. Christy, welcome to the show. How are you doing today?
Thank you, Vic. Good morning. Happy Valentine's Day to you and everyone.
Yes. Yeah, thank you. So today we're going to talk about certification. I know I was certified and we just talked about you're certified, but we're going to get into the real details. Now, how long have you been president?
I am in my second year. So the term runs October of 24 through October of 26. But I've been on the board for, I think, 6 or 7 years now.
Great, great. Well, I don't want to keep the audience waiting. I'm going to bring your slides up and have you go ahead and do your presentation.
Great. Thank you, Vic. Thank you for that very generous introduction. Good morning, everybody. I hope that you're snuggled up to your laptop with a cappuccino and some toast and jam. And we have a little bit of a Valentine's theme going on here, but basically let's show some love for CBUNA. I'm excited to provide both updates on what's been going on with CBUNA recently, but also provide an overview of the exams themselves, study tips, and sorry, I'm navigating not correctly. Benefits of certification, eligibility. I've got some tips for how to think about maybe getting the exam paid for by your employer. And we're also going to talk about how the exam is maintained and developed. And we're going to talk about recertification. So we've got a lot to cover, and I'm excited to speak on this topic, which is near and dear to my heart. We will have time for questions at the end. So feel free to think about anything you have questions about. Okay, so what is certification? Well, certification is a process by which an association or a non-governmental association or agency validates an individual's qualifications and knowledge of practice in a defined function or clinical area based on predetermined standards. So I think what I just want to highlight is that certification, of course, is available in all kinds of nursing specialties, but it's also recognized in many other industries such as accounting and engineering and financial planning, right? Lots and lots of professions have certifications. So this is not unusual in our current world, but CBUNA is the only national certification body which is established to certify urologic nurses. And so in that respect, we are unique and offer something that really nobody else does. Our mission at its foundation is to improve quality of care. So the mission of CBUNA is to improve the quality of care provided to urology patients by promoting and acknowledging the highest standards of urologic nursing practice through the certification process. So fundamentally, we all know we're here about patient care. The history is pretty interesting. So initially, the exam was offered as a 4-hour oral exam administered by a panel of urologists. So in the same vein of how urology residents and other specialty residents have their oral boards. It was like an oral board. Talk about stressful, right? But despite this, over 40 nurses submitted to this oral exam when it was first offered in 1974. That sounds just extremely stressful to me, especially in that era when there was such a division, right, between nurses and physicians. I just think that sounds pretty intense. But eventually, actually shortly thereafter, the exam became a combination of oral and written exam, and then ultimately transitioned to a written exam. Now, when I took the exam in 2008, it was paper and pencil, and we offered it twice a year at the conferences. But after that, it went to brick and mortar testing. So it went to an electronic format. In a similar place where you would have taken your NCLEX or your AANP exam. So these sort of prison-like testing centers where there's a person there, making sure that you're not cheating. Basically, they take your phone away, things of that nature. So it's been in this brick and mortar system for many years, but just this year, we've transitioned to what's called remote proctoring. So this is super exciting. And again, we just moved to this basically this month. So remote proctoring is a system where you take the exam on your own computer. You can take it at home. You can take it at a conference room at work. You can take it in a library room if you can, get a quiet time reserved there. So it offers so much more flexibility for people who live outside of major cities, right? Where they don't have to travel to get to the exam site. It's also available 24/7. So if you're a night owl and you're like, I do my best at 11 o'clock at night, which is of course not me, you can schedule your exam at 11 o'clock at night. So 24/7 flexible remote proctored exam. So basically on your laptop, you would have what's called a lockdown browser so that you can't navigate to other places on your laptop. And there's a live person watching you through your camera, and you have to also have your phone set up, and they're basically watching to make sure that you're not referencing any other resources. So this is super exciting evolution for us to be at this remote proctored offering, and we're very excited to move forward with that. So there are many, many benefits of certification, and people's reasons for certifying vary. They can be personal reasons, like I just want validation that I know what I'm doing in this specialty and that I have this special knowledge and skill. Some people get financial stipend from their employer or a salary increase, but I would say that is not that common, to be honest. Some employers require certification after a certain number of years or encourage it or incentivize it. But there are also lots of intangible benefits, such as increased opportunity, feeling more motivated to stay up to date in the field, having more credibility. The thing that's being written a lot about certification right now in nursing has to do with empowerment. So a lot of studies are being conducted currently about both informal empowerment, so maybe feeling empowered to speak up in a setting because you have this specialty certification and specialty knowledge, or formal empowerment, being able to sit in a meeting or sit at a table where decisions are being made because you have this extra level of skill. So main point is there are both tangible and intangible benefits of certification, and those reasons that you would seek certification or have sought certification may be different for you than for a colleague or a friend, but many, many reasons to certify. So CBUNA offers 2 exams currently. We offer the Certified Urologic Registered Nurse, so the CURN, which is 150 questions, and you have 3 hours to take that exam. We also offer the CUNP, which is the Certified Urologic Nurse Practitioner, 175 questions, 4 hours. Both, of course, are offered in this remote proctored format. To be eligible, you have to be licensed as an RN or an NP, whichever is your exam that you're pursuing. And you have to have an unrestricted nursing license, and you have to have been trained at an accredited program. Additionally, you need at least 2 years of experience in the role as an RN or NP, and at least 800 hours of clinical practice in urology, so in the specialty. So for most people, that looks like, I work in an outpatient urology clinic. But for some people, that is, they work on a unit where lots of people have catheters, or they're treating post-operative patients who have had cystectomies or nephrectomies, things of that nature. So it can be both inpatient, outpatient, just 800 hours, which of course is not that difficult to achieve, right? That's 20 weeks of full-time work in a urology setting. So for some people who only 50% of their patients are urology, they certainly can still qualify. And then you just complete an application and the eligibility is verified by our staff at our management company. The exam is structured, as I mentioned, through computer-based testing, remote proctored exam. It is at this time all multiple choice format. So, a STEM question and then a selection of 4 answers. Just usually you can rule out 2 of the answers, and the remaining 2, if it's not clear to you, taking a guess. You always want to guess. You never want to leave a question blank. But they're all multiple choice format. We're so excited about this new remote proctor format, though, because the platform that we're using is going to permit us to write different kinds of questions going forward. So instead of having just multiple choice, again, the exam currently is entirely multiple choice. But going forward, we're going to be able to insert graphs and urodynamics tracings and have matching type questions and have true, false, just have different kinds of questions that will make the exam, I think, more robust, more interesting, and more fun to take and more fun to develop, which we are kind of into. The current exam, some questions are multiple questions on a single STEM. So the STEM is the description. Johnny is brought by his parents for Core D. He's, 2.5 years old. And then you may see that same STEM with multiple questions pertaining to that. So just be alert to that. The content is, as Vic mentioned in the introduction, it's about clinical knowledge, professional practice, patient care standards, and pharmacology appropriate for the RN or the NP. And basically the amount of knowledge is we set a concept of the RN with 2 years of experience. What would we expect an RN with 2 years of experience to know? What would we expect an NP with 2 years of experience in urology to know? So you don't have to know everything, and you don't have to know the most up-to-date things either. It really is foundational knowledge, understanding anatomy, physiology, patient care standards. It's just not the most up-to-date, the late-breaking oncology treatments. That is not what this exam is about. It's about your base fundamental knowledge about urology and urologic care. The exam also follows what's called a blueprint. And I want to talk next about exam development and how we develop the exams and something called the practice analysis. So let's start with practice analysis, because that is sort of where we get our breakdown of topics for the exam. So the practice analysis is a survey, a fairly robust and lengthy survey that is typically sent out by our partners at the Urologic Nursing Journal, and CBUNA helps with this as well. But Suzanne Qualich is generally the person who's developing and sending out and collecting the data for the practice analysis. So it will go out to all registered nurses who are certified and all nurse practitioners who are certified, and ask a bunch of questions like, what kinds of activities are you performing in your clinical practice? For nurses, for example, are you administering intravesical chemotherapy? Are you removing nephrostomy tubes? Are you counseling patients? Are you providing postoperative care? And then how important are each of these activities to your role as a nurse in urology or your role as a nurse practitioner in urology? So the practice analysis results come back and give us all this information about what are nurses and nurse practitioners doing currently in urology. Then we have to basically make the exam reflect current practice. This is our way of updating the exams. So we develop what's called the test blueprint. So the blueprint is all those activities and how is it balanced? And I'll show you the RN blueprint in a couple minutes. So when we're rebalancing the blueprint, which describes the different portions that are in the exam that reflect practice analysis, I know this is a little hard to wrap your head around, we have to write new items to, so let's say more and more nurse practitioners are seeing oncology patients in urology. So we need to write more oncology questions to reflect the practice analysis and the blueprint. So write more items. Each exam that is given is a set of validated and established questions that we are scoring. And then there are a number of new questions that we've written that are unscored. So each item or each question has to be evaluated for, is it valid? Is it working? In other words, if we have a new question and 60% of people are going for A and 40% of people are going for D, we have to consider, well, is there something wrong with the way we've worded it? Is it confusing? Could A and D actually both be correct? And that's why it's not working. So each item has this long history of evaluation after it's first put on the test, and only when it's found to be valid and working properly is it then added to the scored items. So as we're rebalancing the exams for the blueprint, we are also retiring items that are outdated or that aren't functioning or that we tried to fix and still don't function. So constantly rebalancing, rewriting, removing, and updating the exam. And then the final process that we undergo in terms of exam development is called the ANGOF. And this is a word you might never have heard of. My spell check doesn't like it at all. It always says, what is this word? So the ANGOF analysis is where content experts basically look at each question and come to a consensus about the numbers of RNs, for example, with 2 years of experience, who should be able to get this question right. And so in this process, we establish what's called the CUT score. And the CUT score basically determines what is the passing score for the entire exam. So for the RN and for the NP exam, what is the passing score and what is the failing score on the other side? So the ANGOF is a way of setting what's called the CUT score for passing and failing the exam. So this is all going on in the background of both exams on a routine and dedicated schedule. So it's a lot of work in the background, but we as the board kind of geek out on this stuff, so we enjoy it. I want to just show you as an example the RN blueprint, and it has an Axis 1 and an Axis 2, and these are published on our website. They're also contained in our prep guide if that's something you're interested in purchasing. So these are public. These are not secret, right? This is the exam. So the RN blueprint Axis 1 is patient problems. And so here you can see the breakdown of patient problems. 25% is obstructive uropathies, for example. 5% is pediatric. So this helps you think about which of these topics are familiar to me. I do UTIs all the time. I've got that, but I never see cancer. Well, then you're going to need to focus more on cancer. But this is the blueprint that came from the practice analysis that is reflected in the questions. The second axis is nursing activities. So we are nurses, we are treating certain things, but as nurses, we are doing all these other important things as part of our care. And so we're assessing and monitoring patients. We're planning and implementing care. We are teaching patients. We are evaluating outcomes. And we are ensuring professional practice through things like leadership, staff development, consultation, quality improvement. So each question is evaluated and linked to both an Axis 1 topic. So one of these topics, each question has to be related to one of these patient problems and also related to a nursing activity. So every question is coded for its focus on the patient problem and the nursing activity that it involves. So this is the blueprint that you should definitely become familiar with if you're interested in studying for and taking the certification exam, because it does help guide your study, basically. Okay, so speaking of studying, I have some tips for you. Probably not rocket science, but I think focusing on the topics you don't encounter in your typical practice, of course, makes perfect sense. And that may be a little bit uncomfortable, like, well, where do I start, with studying oncology if I never see oncology in my practice? I'm going to give you some resources on the next couple slides, but think about the topics that you're not that familiar with. You're going to organize your study so that you're covering all the topics on the blueprint. We don't really recommend cramming. This is basically a big bundle of information, right? Extremely broad. You're going to be tested on basically the entire specialty. So cramming is not going to work. I'd recommend tucking little kernels of learning into every day. Be proactive in understanding what's happening in the practice environment where you are. Ask the urologists or the nurse practitioners or the other experts in your group. Ask questions if you don't understand what's going on. Understand the rationale for things. Maybe make some little notes of, oh, I've never heard of that medication before, or I don't really understand bladder cancer staging. They're talking about, stage 1, stage 2, TA. Make some notes for yourself. And then at the end of your day, go look up those topics that kind of hit the bell in your head of like, I don't know much about that. And just be proactively thinking about learning every day when you're at work. A great way to use commute time is to queue up urology podcasts or previous UroNurse episodes and listen to those while you're commuting. A lot of people benefit from having a study structure. So partnering with a colleague or a friend at your workplace to study together, set some time aside and, schedule it so that you hold each other accountable, whether you're actually talking about things or just sitting side by side and studying, just to keep each other accountable. It can help to have a study buddy. And then a lot of test takers say, oh, I just need to register. If I just register and schedule my exam, then I'm going to have, a target. It's going to force me to sit down and do the work that I need to do to study. So register, schedule your exam, and then just work towards that deadline. You do have 90 days after registering to take the exam. So I think it's also helpful to think about your study style. Some of us are visual, right? And we like to read, and that's how we remember things. So take a look at the core curriculum for urologic nursing, the nurse practitioner in urology, 5-minute clinical consult. There are, of course, tons and tons and tons of textbooks, which are listed in our prep guide. If that's the way you like to learn, right? If you want that physical book in your hand and you want to be able to highlight and put flags on things, get some of those resources and spend some time with them. A lot of people like hearing things, so download lectures. Again, UroNurse episodes. AUA has a good podcast, robust podcast system that you can listen to. Those are free on podcasts as well. Websites that you might go to, the Pediatric Urology Nursing Society, we've kind of partnered with them because a lot of test takers worry about the pediatric content. That's something they just don't quite know where to find the right information for. So PUNS, the Pediatric Urology Nursing Society, you can't purchase individual courses on their site, but they've directed us to their affiliate membership, which is $50 for a year. You don't have the opportunity to vote as a member, but that's not really our goal. But for $50 for the year, you can access all the content that they have on their lecture. They have things called Tuesday Teas. They have pre-recorded lectures or recorded lectures from their conferences. So consider joining as an affiliate member or a full member if you prefer. And that's a great place to get some pediatric content. Another place that we use a lot for writing questions and sourcing our answers to make sure that the answers are correct is the American Urologic Association practice guidelines, right? They're pretty, it's a lot, right, to take in, but those are available free. You don't have to read the whole guideline. It's just bulleted main points. And that's also a great place to, a great website. Another website is called Stat Pearls, and this is listed on the next section, which is sample test questions. People are always wanting more. I want more sample test questions. I want to be able to test myself. I want to be able to see how I'm doing. So our certification prep guide offers a number of questions, but this Stat Pearls website, which you do have to pay for, has tons and tons of questions, and they'll send you a question of the day, which is helpful. Just one caveat about Stat Pearls. It is written for urology resident boards. So people who've used this have said, gosh, the Stat Pearls was a lot harder than your exam was, but that's not surprising because it's written sort of at a urology resident level. But they also provide the rationale, and so that's a great resource. And then every urologic nursing journal going forward, we're going to have an article. We've had articles in the past that you could reference, but also going forward, we have a column called Getting Ready for Certification, and we have a particular topic. This topic in the March issue is men's health, and we've got 5 questions in there. So you could look up the previous articles published in the Urology Nursing Journal, called Getting Ready for Certification, and those articles include some test questions as well. So just a shout out to the board. We are a group of 7 to 11. Right now we have 7 certified nurses and nurse practitioners, and we kind of geek out on the process. We love the item writing. Some of us like the ANGOF. I would say that's not my favorite part. We love tweaking the questions and looking up the answers and making sure we have appropriate references for the answer for each question. We really have a good time with that. But we cannot do this on our own, right? I've described to you kind of how much work is involved. So we partner with an association management company, Kellen, and we just employed Kellen last year, the same company that the Society of Urologic Nurses uses. And they help with our website and our marketing, and they answer our phones and our emails and set up platforms. And so they've been great to work with. They're updating our financial processes. It's they're a great company. We're excited to work with them, and we could not do it without them. And then we also have a testing partner. So our current testing partner is Certification Management Systems, and they are the ones who are maintaining the platform for the remote proctored exam. They handle registration for the exam, which you can do on their site. They hire the proctors. So they are also critical to our ability to provide these exams on a consistent basis. And they also help us with the test development steps. And both of those companies work with us to maintain the test with those 5 stages that I had on the wheel a few slides ago. And then, of course, we have a close association with the Society of Urologic Nurses and Associates. Sorry, there's a typo there. So they are our sister organization. We work closely together and have a lot of overlap, of course, of membership, although we do have separate boards, separate finances. We all have the same goal of promoting urologic nursing scholarship and practice and expertise. So I want to talk about a few upgrades. My slide initially said updates, but these are actually upgrades, I think, for us. Unfortunately, we had to retire the Certified Urologic Associate exam effective December of 2025. So people taking that exam were typically medical assistants, LPNs, sometimes industry representatives. Unfortunately, we had as few as 4 people taking that exam in a year, and we just can't maintain there's not enough statistic basically engaged in that few of a number of test takers to maintain it. This is not unprecedented. We previously offered a clinical nurse specialist certification. We previously offered a physician assistant certification, and those were also retired in the past. So we just had to refocus and reprioritize and recognize that even though we were keeping costs low for that exam, there just wasn't enough interest in it. So we did retire that. Now, all those exams that are retired, those people can maintain their certification for sure. They can become recertified. They just can't certify as a new associate, and they cannot recertify by exam. In 2026, as I mentioned, we've transitioned to this remote proctored exam, offering incredible flexibility, accessibility 24/7 with adequate security and the exciting opportunity for us to make different kinds of questions. So we're super stoked for that. Also, this was a big step. We now have electronic registration available. So previously, if you wanted to take the exam, you had to mail your form with a check or a credit card, and there was this lag in getting your authorization to test. Super excited to announce that right on our website, on the CBUNA website, there is a link where you register, pay your fee, and then within 2 weeks is our goal. You should receive, or faster, you should receive your authorization to test once our staff has ensured that you are eligible to sit for the exam. And then you'll get your authorization to test. There will be a URL, and your email basically gets you into the site so that you can register for your exam. And then you have, as I mentioned, 90 days. So this is absolutely great for our customer service. The anxiety of waiting for your authorization to test is going to be practically eliminated. It's just going to be so much more efficient, and better for everyone. We're super excited about this. A big project that we are working on at the board is revising our prep guide. So if you have a copy of the prep guide, you probably know that it was a paper, kind of stapled paper pamphlet kind of thing. It's fairly long. It's between 70 and 100 pages long, and has lots and lots of information for studying. But it was becoming a little bit outdated in print format. So I'm excited to announce that we are revising that, and it's going to be in electronic format. So it's going to be easy to look at the different sections. It's going to have the test questions I mentioned. It's going to have updated study resources, both paper resources, but also lots of web resources that you can just click right into. So we're super excited for this. We hope to have the final version published by the end of March. It's the same cost, but if you purchase the paper version, or if you recently purchased our electronic version that is the same as the paper version, you will be eligible for a free copy of the updated one. We really want people to have access to the study guide. And so just reach out to our staff if you purchased it in the past. And once we have the new one published, you will get a free one if you purchased in the past 2 years. I want to mention funding for the certification, right? It's not cheap. It costs between $350 and $450 some dollars, and less if you are a CBUNA member. But keep in mind that your employer may reimburse you for certification. They might pay outright for it, or they might say, hey, bring us your certificate and your receipt, and we will reimburse you once you are certified. Consider asking your department or someone in your practice, if you have a physician or an APP that you work with and you think they really would encourage your pursuit of certification as a enhancement of your skill and expertise, consider asking if they would sponsor you for it. CBUNA also offers group discounts. So if you have 5 people in your department or practice who want to get certified, reach out to our team at Kellen, and they can talk to you about how to get the group discount. CBUNA offers a certification scholarship every year that sometimes goes unused. So please consider applying for that. It is right on the website. Again, you get a discount for CBUNA membership. And then some folks, of course, have a continuing education budget. Most nurse practitioners have a continuing education budget that they can use to pay for their exam. I want to briefly mention recertification. So once you get certified, your certification is good for 3 years. And then every 3 years from October to December is essentially when most of the recertifications occur. And there are some qualifications that you have to reach for recertification. In that period, you have to have had 800 hours in urology, which again is 20 weeks of full-time work. So very easy to accomplish that. You also need 36 urology-specific continuing education hours, and up to 6 of those can be in nephrology. So you could have as many as 6 nephrology and 30 urology. And while that sounds like a lot, that's only 12 a year. And we'll talk about some sources for those continuing education credits, but it's really not onerous. Most of us are getting that number of hours just in our participation in conferences and things of that nature. For the RN and NP, you can also recertify by exam if that is your choice. If you'd rather do that than the continuing education, that's an option. But I would say 98 to 99% of people do it with continuing education. We do have an audit process. It is not punitive. It doesn't mean you've done something wrong. If you get audited, it is entirely systematic. So every 10th recertification applicant is audited, and they'll just ask you to submit your documentation for your continuing education hours. And once they review that, you're good to go. We also have a recertification scholarship. So please consider looking into that, especially if you feel like this is something that's difficult to afford. For your continuing education, so many sources. This is just a tiny list of many, many places that you can go to get continuing education. But of course, CBUNA conferences or other urologic conferences, PUNS conferences would work. As a CBUNA member, you get a monthly free nursing continuing education development credit. They've currently separated into a general general NCPD, and an advanced. So those are available every month if you're a CBUNA member. So that's 12. That's the 12 you need per year with nothing else. If your department has grand rounds, and if you're tuning into those or attending those, they typically offer continuing education for that. And then, of course, there are just a few other websites, many other websites. This is just a few of them. Stat Pearls also offers the continuing education. So how do I apply? Well, again, I think reviewing the content on the website or the prep guide, making sure that you meet the eligibility requirements, and then go to our website, submit your application right there online. You will then get your authorization to test in the form of an email. You take that URL and schedule your exam, and then you take and pass the exam. Right on. So it's very easy to apply right now. This is contact information. So this is our website, www.cbuna.org. It will take you, we are kind of a sub page on the CBUNA pages. So it's closely linked with the CBUNA pages. But if you put in cbuna.org, it will take you right to our page. And then that's our general email box for our staff people. So that's all the slides I have. I would love to answer any questions that folks have.
Yeah, that was great. I mean, it's actually an exciting time with all the changes that have taken place.
Yes.
And as being one of the guys that's been certified, some 40 years ago originally, I got certified, passed, and then the recertification was take some kind of retake the test, like you say now, or it was do some work study program. And believe me, when it comes to work study, I'm like, no way. So I took the test twice. Now, thankfully, much easier by just doing with the contact hours.
That's fascinating. I had never heard of that work study option. I'd love to hear more about that sometime.
Yeah, it was. I don't know. It was. If you go back 40 years ago, that's how it was done.
Did you have the oral exam?
When they used to. What's that?
I was going to ask. Did you have the oral exam? Was that?
I was just going to say I didn't have to do the oral exam. It was actually the pencil at the paper one, but yeah. It was crazy. So yeah, no, it was great. Anybody has any questions, please feel free to put those in there. Otherwise, I'm going to occupy the time with some questions that I have. So I understand the CUA is gone now, and that makes sense. Yeah. I think that's one of those things that, as you said, you're not having a lot of people, that are applying to become that. It makes sense that we just down to 2 tests. So probably a little easier on your side too, for CBUNA, right? Just only watching.
Yeah. I mean, as I discussed, the maintenance of these exams is not small. And basically, if we think about medical assistants, they tend to not have funds to attend conferences, to, pay for the exams. And so I think that was part of it. We tried, we did not raise the price on that exam for many, many years. We kept that price as low as we could, but we also had trouble recruiting board members who were medical assistants or LPNs. Mm-hmm. So that's the other part of it, is to offer that exam. We also needed to have board members who matched those criteria. So it was not an easy decision, but it became a clear decision as those numbers just continued to decline. Doesn't mean we couldn't offer it in the future, but just for now, it's not viable.
And fortunately, if you've already been certified, then maintaining it's not an issue. You'll still be able to maintain it.
Absolutely. It is still a huge accomplishment. And this in no way detracts from the accomplishment of having become certified as a CUA or a CUCNS or a CUPA. And absolutely, the recertification will remain available and viable.
All righty. Do have a question that just came in from Susie Swain. I'm a medical assistant. Can I use CMEs available at UroNurse towards my CUA recertification? So are there limits to which types of education you can utilize?
It has to be. That's a great question. Thank you for posting that, Susie. So it has to be from an accredited body. So Vic, do you offer accredited?
They are accredited. Yep.
Okay, I'm sorry, I didn't realize that. That is awesome. So Susie, absolutely. So if it's accredited by the NCPD or by the medical GME or through AANP or ANCC, absolutely. Yeah, just Vic, do you provide can people download a certificate, or how do they track?
Yep, they get a certificate. Correct. That's right.
That's awesome.
So,
Forgive my ignorance.
we kind of collaborated with my CME, which is a group that puts out all these different programs.
Mhm.
And years ago, I asked them early on, hey, I'd like to do kind of a watch party type thing. Can we utilize that? And they said, yeah, we're on board. So UroNurse offers about 10 hours of every year of worth that you could utilize towards your certification hours.
I love that.
All
That's
free.
awesome. That's awesome.
So I really appreciate that you did mention, for studying things like the UroNurse podcast, because we put this into an audio form. And I've had people come up to me and say, hey, I took the certification exam and I listened to you in my car every day going to work. And that was a big help. So I think that those things are great to have as resources.
I love it. We didn't even pre-talk about this. That was just karma. Love that.
Just worked out great. So let's see if I have a couple other questions here that popped up here. So that's what I thought would be good for you. On a personal level, how has certification shaped your own professional journey?
That's a great question. I was a surgical nurse, and then I was a urology nurse for many years before I got my NP. And I did not choose to become certified as an RN. It just wasn't happening in my practice. It wasn't standard in my group. But subsequently, for me, studying for the exam absolutely heightened my knowledge and understanding. So the preparation for the exam made me a better and more informed clinician. I absolutely believe that. And then, maintaining certification requires that you make sure you have some continuing education. So I think it keeps you current. It keeps you kind of in the loop of urology. I'm retired from clinical practice for now, but my department did not incentivize, I was at a big academic health center. They encouraged it, but we didn't have any salary stipend. I did end up having a leadership role. To what extent certification contributed to that, I can't really say directly, but I absolutely believe it made me a better clinician and more knowledgeable. And I was certainly seen as an expert in the field, in my department. I would say the biggest for me was the clinical expertise was extremely valuable and meaningful to my patient care.
Yeah. And I think, it's easy to put our nose to the grindstone and just work, and just kind of do the work. But if you're not keeping up with this, especially urology, and it's kind of one of the things I like so much about the field of urology is it's just changing so fast, and trying to stay on top of things. You're going to get lost quickly if you don't, do some kind of outside of activities of just working every day. So I think it's really good. Now, personally, for certification, when I got certified early on, one of the docs that I worked with, every time I came in to see a patient with him, he'd say, "Oh, this is my nurse, Mr. Senese." And he's certified, board certified like I am in urology. He was more proud of it than I was. So I think that, as you said, there's a certain amount of pride.
Yeah, there's pride. And I think you're kind of talking a little bit about marketing, Vic. So there's a group in Virginia who I noticed that there were 3 nurse practitioners from the same address, basically. And I was just doing some kind of research on what was preventing people from certifying or what was encouraging people to certify. And so I actually talked to their practice administrator, and he actually puts up billboards in their community advertising that their nurse practitioners are certified, because he said, look, first of all, he said, the number of urologists is declining, right? We all know there's kind of a crisis coming of urologists retiring and not enough people coming into the pipeline. So nurse practitioners are going to be filling that gap for sure. And then he also said, I'm competing against another urology group, and I want the patients coming to us to have confidence in the nurse practitioners that we're asking them to see. And so they advertise that their nurse practitioners are certified within their community, and they absolutely pay for their exams and encourage them to get certified in exactly 2 years. So these 3 people taking the exam had all been in the group for 2 years, and it was like time for certification. So we would love to see, that kind of understanding at the practice level of the value to patient care and the value in terms of marketability as well.
Yeah.
And also for their nurses, they certify their nurses as well.
With the ease of taking the test now where you can do it from your home, that's going to make a big difference, because sometimes that's a big barrier. Back in the day, like I said, when I took it, you had to do it at a conference. So, you had to go to a conference, you had that expense. Now it's just a matter of sitting down and taking the test. And we were talking behind the screens because sometimes the first thing I wondered, I'm like, I could have a second computer over on my side and be looking up the answers, or just say the questions out to ChatGPT and get the answers. But you had said there's a lot of safeguards that they have in place.
Absolutely. So
talk about that.
Absolutely. So this company, CMS, Item Experts is their website. They offer exams in all kinds of different areas. And this technology is not brand new. It's been around for at least a few years. And so basically the proctor is basically watching your eyes. And I believe there may also be a program that's watching your eyes that maybe alerts the proctor to, hey, this person's looking, down to their left, like, not even turning their head, but just your eyes. So after a certain number of times that they might call you out, or a certain number of infringements, they can basically stop the exam and say, I really feel like you're using something that you shouldn't be using, So yes, there are definitely security issues to prevent that. There also, I just want to also mention the security of our exam, right? Our exam is confidential. And even when we are working on the exam as board members, or anyone that we bring in for a task force, we sign non-disclosure agreements, right? So not only do we want people to not utilize notes or resources while they're taking the exam, but the exam itself is private and confidential, right? So what's on the exam is not, the individual questions. Of course, there's no overlap. That's the other thing I want to mention. The sample questions that are on all these places that we talked about are not the test questions, right? So when we're writing sample questions to publish for the journal or to put in our prep guide, those are not the actual exam questions, right? The actual exam questions are under lock and key. So lots of security. Good point.
And I always call it they say multiple choice. I call it multiple guess. I mean, as you said, there's two that you can almost immediately just get out of the figure. So these two you're down to a 50-50 shot. So, and if you've studied, I always say, if you don't overthink it, you're going to do great. That's where people get in trouble on testing. I've always been a great test taker, and it's only because I just do it and don't even go back and reread questions, because then you start to make scenarios up in your head that don't exist. Just answer it and go on.
You make such a good point. I'm glad you mentioned that, Vic. So the questions are not designed to be tricky, right? And all the information that you need to answer the question is in the STEM. In other words, you don't need to think about, well, do they also have, X, Y, Z?
Right.
No,
in the scenario.
All the information is in this, what's called the STEM, or the scenario that you need to answer it. So yeah, you don't need to fabricate other parts of the story to go along with that. That is a good point. They're not designed to be tricky.
Yeah, great. Do we have a question that came in from Carolyn Mathis? I've been using the Stat Pearls questions, one a day, to prepare for the NP exam. So.
Yeah, when we first started hearing about Stat Pearls from other NPs who were studying, Carolyn, I wasn't really sure what it was about. And so we actually had a meeting with them, because we're going to start collaborating a bit where we will direct people to their website, and they will offer people studying for our exams a discount on their programs, which will be great. I'm sorry that wasn't in place, for your studying, but I asked them to start sending me the question of the day, because I wanted to see what the quality was like and see if it seemed relevant. And if you want to, I don't know if she can type in the chat, any more about her experience with that, but I've seen the questions, and some of them seem a little far-fetched, or I don't always agree with them, but they're being written by experts in the field, and they provide the answer and the rationale, which I think is really helpful. And it's actually the format where you get the question and you can actually select, and it'll say, or yeah, you got it. So it really is a good preparation, I think.
Let's see. I just got something here from Carolyn. Been nice to have a question.
Yeah, I think it's a good site.
All right. So it's been great. I think we really covered everything there is to know about being certified. Definitely encourage everybody, take the certification. It does matter. Patients now look at your credentials on your, what your lab coat or whatever you're wearing. And they wonder who's taking care of them. And I think it's more reassuring if they know that you've got some profession behind you that's saying, this guy kind of knows what he's talking about, or gal. So, I think it's something that we need to encourage people to do. It's going to be easier to do. Find ways to, look for scholarships, etc. Because as you said, there's a lot of the scholarships that nobody even applies for that could have paid for your exam. So
True.
Lots of ways out there. All right. I'm going to play a little promo for next week's program. For those of you that have been with our show for a while, you know that early on I had Dr. John Lynn, a urologist out of Arizona, who's been joining us. He's been busy and I haven't been having on the show in a long time, but he's coming next week to present.
Is TURP still the gold standard for treating BPH in the era of lasers, implants, and minimally invasive therapies? In this in-depth educational discussion for UroNurse, renowned urologist John Lynn, MD, shares his expert perspective on TURP, a procedure he remains deeply passionate about and has performed over 100 times annually for many years. Dr. Lynn breaks down why TURP has stood the test of time, where it still excels, and how it compares to newer BPH treatment options. Join us on February 21st at 9 a.m. Central Time to learn more.
Yeah, so I'm going to be looking forward to hanging out with Dr. John Lynn again after a long time of spending times every week with him. Should be fun, so be sure to join that episode. Christy's been a great episode. Glad you could spend some time with us and explain more about certification. Definitely want to get you back on because I know this is going to be a subject that people are going to want to learn about more. So
thank you, Vic. It was a great
having you on.
Thank you so much.
Got a bunch of thank yous that came in on the comments. I won't put them all up on the screen, but everybody else appreciated it too. All right, we'll see everybody next week. Hey, take your special Valentine out and do something nice for him or her.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.